Okay, first I'm going to talk about lifts and chops. So lifts and chops are another kind of PNF techniques that can be used. They're kind of used more to emphasize kind of trunk control. So in both cases, you have one arm moving the other arm, okay? The arm that's being moved through a particular pattern is known as the lead arm. So a lift is when you take the lead arm through the D1 flexion pattern, or through the D2 flexion pattern. Okay, so the lift is the D2 flexion pattern. So remember, you're going to start over here in the extended position, only deviated, and then you're going to come up and across. A reverse lift is taking you through the extension pattern. Okay, so again, a lift is taking the lead arm through the D2 flexion pattern, and a reverse lift is going the other way, doing the extension. So for example, for Mary, I can say, okay, I want you to hold your, with your left arm, hold your right arm, okay? And I want you to start with your right arm kind of across your body and kind of towards your pinky side, all right? And now what I want you to do is I want you to lift your arm up and across your body with your hand out, okay? So come back. So you're gonna start again, and you're gonna have kind of a fist down here. Okay, so make a fist, and then as you bring your arm up and across your body, away from your body, let your fist go, all right? And then bring it back down. So again, the going up, that's the lift, so bring your arm up. Coming back is the reverse lift, okay? A chop is taking a patient through the D1 extension pattern, okay? So remember the D1 extension pattern, you're gonna start from here and go down here. And this is kind of, it literally looks like, right? It literally looks like a chop, okay? So you're gonna start with the D in the D1 flexion pattern here, okay? And you're gonna ask the patient like you were gonna chop something down, like you're gonna chop some wood, and bring it down by your side, okay? So like that. So you're gonna start, you're gonna hold your right arm with your left arm, you're gonna bring it up across your body, you're gonna make a fist, okay, with your arm right in front of you, and now you're gonna you're gonna take this right arm and bring it down by your side and twist it out with your hand open. So make a fist and pull it up. That would be a reverse chop. Now you're going to bring it down, and that's going to be the chop, okay? So again, a chop is taking the patient taking their arm through the D1 extension pattern. A reverse chop is taking them through the D1 flexion pattern. And this can be done for a greater challenge in 2 points. So why don't you get on your knees? Okay, so why don't you face him? Yeah. So let's do the other side. So with your right hand, hold your left arm, okay? And we'll do a lift first. So you're gonna bring your left arm kind of across your body. You're gonna make a fist and kind of have it towards kind of your pinky side. And you lift that arm up and away and open up your hand. Okay, again, that's the lift. As you bring it back down, that's a reverse lift, okay? And then the chop, you're gonna start, so again, we'll have, take your right hand and hold your left arm, okay? That's gonna be up in front of you with your wrist kind of cocked towards your thumb side, with it right in front of you, and you're gonna bring it down, like you're trying to chop some wood. Right, down and out by your side. That's the chop, and then bringing it back up. So bring it down for the chop, and bringing it back up is the reverse chop. And those are lifts and chops. Okay, so come back, lie down with your knees bent. So now I'm going to talk about some of the techniques that are used for functional movements. And most of these techniques are only used for functional movements. There's a couple that I've talked about that can go either way, functional movements or extremity movements, but most of these are only used for functional movements. So a common technique is something called rhythmic rotation. And rhythmic rotation is just passive lower trunk rotation. Okay, that's all that it is. All right, it is the only inhibitory technique really in the PNF, among the PNF techniques that we talk about, and generally it's used to decrease tone. The rhythmic initiation is also with lower trunk rotation, but rhythmic initiation has a particular sequence. So with rhythmic initiation, you're going to start with passive range of motion. You're going to tell the patient, I'm going to move you, I want you to feel the movements first, and then I'm going to ask her, I want you to try to do the movements. So now I'm kind of going from a passive to an active assistive, and then as she gets the movement, I let it go. And then as she gets better, I actually can give her resistance either way. So push against me here, and push against me here. You're not necessarily going to do that all in one session, but that's kind of, you can relax. That's the sequence, all right? So rhythmic initiation has a very specific sequence. You go from passive to active assistive to active to resistive. Rhythmic rotation is really just the passive lower trunk rotation, okay? Go ahead and sit up for me. So those are things that are commonly done kind of at the mobility stage when you're just trying to initiate movements. Techniques that can be used for stability include rhythmic stabilization and what's called alternating isometrics. So both of these are used primarily for trunk control, and they can be done in a variety of postures. They can be done sitting, they can be also done in 2 points or in 4 points. So in both cases, you want the patient to try to hold their trunk steady, okay? In terms of alternate isometrics, I'm gonna say, please, I want you to don't let me move you, and I'm gonna push her on one side, and then I'm gonna switch to the other side. Okay, so again, it's alternating because I'm switching my hands. Isometrics because there's no actual movement taking place, right? So I can do it like this. I could also do it in a different plane. I can go side to side like this. The rhythmic stabilization is also, again, focusing on an isometric contraction of the trunk, but this time there's a rotary component. So now instead of having my hands on one side, I'm going to have one hand in front and one hand in back. And I'm going to say, please don't let me move you. Okay, and so now I'm pushing in a rotary direction, almost like I'm trying to twist her. Okay, so similar idea, I'm trying to promote trunk stability, but this time I'm pushing in different directions. Okay, so both rhythmic stabilization and alternate isometrics are techniques for stability. They can be used in sitting. You can also do the same thing, for example, in 4 points if you want to get on your hands and your knees. Okay. So I can say, don't let me move you, and I can push from here, from one side, or from here, for alternate isometrics, or again, kind of a rotary component, I can push from different directions. And again, the focus is on basically stability of the trunk, okay? Go ahead and sit up for a minute. So slow reversal and slow reversal hold are movements that I talked about in terms of PNF extremity techniques, but they can also be used for functional movements. So for example, basically slow reversal is really just giving resistance to a movement in each direction. So for example, if I can have her sit on the stool for a minute. So for example, for like say a sit to stand movement, I can give her some resistance, like here at her hips, and I can say push against my hands. Okay, go ahead and stand up.
Okay.
Here, and then I can also switch to here and say push against my hands as you sit. Okay, I could also do it at her chest, so I want you to lean forward and push against my hands to sit up, and then back here. All right, and again I can have her go, so go ahead and stand up again. So I'm having her push, and then I can do isometric contraction, so resist me, but then I can switch back here and ask you to sit, pushing against my hands. Okay, so again, that slow reversal is just resistance in each direction, and you can just add isometric contraction for the hold. So once you come back on the mat and lie on your back with your knees bent, antagonistic reversal is a very difficult technique that can only used in people who are kind of a bit more high level. And in this case, it's both a concentric and eccentric resistance. It's most commonly used in bridging. So I would ask her to push against my hands and bring your hips up in a bridge, okay? But I don't switch. I keep my hands here. I'm still gonna push, and I'm asking you to lower yourself down. Okay, so that makes it very difficult. She's gotta resist me for the concentric contraction, and then on coming back, she's gotta resist me for the eccentric contraction as well. So the patient has to have some pretty good muscle strength to do that, all right? And just to highlight the difference, if I was doing, say, slow reversal, I would have her push against my hands up, but also I would switch now and have her push my hands back down. So that would keep it more in terms of concentric contraction, but for antagonistic reversal, you're gonna keep your hands in the same spot. So push your hips up, and then resist me going down. And you could also do that in other functional positions. And those are some techniques used for functional movements.